other nuances and for other information, you may refer to the live streaming or for the video of the Laging Handa conducted by the PCOO. So good afternoon. ASEC Rosette Berheria will now give the updates on the COVID-19 health event.
Good afternoon to all of you. Our DOH updates for our public on the COVID-19 health event. As of 12 noon today, 386 patients under investigation have tested negative for the 2019 novel coronavirus or COVID-19, and that there are only currently 66 cases with pending test results. At present, there are 191 patients under investigation who are admitted at various health facilities in the country. A total of 260 patients have already been discharged, including 2 confirmed cases. DOH has also recorded 1 new patient under investigation mortality due to cardiovascular attack. The said patient is negative for 2019 nCoV. We are glad that most of our patients under investigation tested negative for 2019 nCoV. While this is very welcome news, we at the DOH will continue our preparations for the possibility of local transmission, our health secretary said. Updates on our repatriates. As of yesterday, 1 repatriate, a 25-year-old person, was admitted to JB Lingad Memorial Regional Hospital due to fever and ear pain. The patient was tested negative for the 2019 nCoV, was managed as a case of outer ear infection. Patient has been brought back to JBL to the New Clark City to complete the 14-day quarantine procedure. Another repatriate, a 25-year-old female, will be referred to the Bataan General Hospital and Medical Center today for further evaluation and management after exhibiting anxiety-related symptoms. The rest of the repatriates under quarantine remain to be with no respiratory symptoms. Updates on our contact tracing. As of February 14, the Epidemiology Bureau revealed that of the 277 interviewed contacts of the first and second cases of COVID-19, 218 have completed their 14-day home quarantine, while 15 are still on home quarantine. 44 contacts found to be symptomatic had been admitted as patients under investigation. On the third confirmed case, a total of 255 out of 740 contacts were traced, including co-passengers and individual contacts from hotels and hospitals. Currently, 172 had been interviewed. Of these, 93 have completed their home quarantine, while 62 are still on home quarantine. 7 symptomatic contacts had been categorized as patients under investigation and admitted for isolation and monitoring.
Thank you very much, ASEC Rosette Berhere. We will be entertaining only 5 health-related questions because we'll be having another meeting after this one. So 1 individual question per reporter. Ma'am Sheila.
The 386 na negative results, what does it say dun sa virus?
What do you mean? It's negative
yung
for...
virulence niya, ma'am. Yung 300 plus na negative results, anong sinasabi niya sa virulence ng virus?
Okay, pag nirelease po yung resulta sa amin ng Research for Institute for Tropical Medicine, ito pong mga negative na resulta na ito, or mga resulta ng laboratory, it's either positive or negative. For us to get further details and for us to study it further, nagre-request pa ho kami sa kanila ng mga ganitong datos. So sa ngayon, wala po kami ng level of virulence ng bawat pasyente na ito.
Kapag does it mean na hindi siya ganun ka-infectious?
When you say it's negative, it's negative. They do not have the virus. So, pagka sinabi ho natin yung level of virulence, kapag positive na result po natin yan pinag-uusapan.
Okay. Miss Aiko?
Yung profile po nung new mortality.
Again?
Yung Chinese, yung new mortality. Yung profile po niya.
Yung profile niya, 44-year-old person who died of nCoV, and he was here. This was the very first mortality here in the Philippines. Are you talking about that? Oh, mortality. The patient is not Chinese. He's a Filipino. He is 71 years old. He hails from the Region 1. He was confined there in La Union. He manifested with cough. He went to the hospital with cough as a symptom. And then during the course in the wards, he had this deterioration of his condition. Final diagnosis was acute myocardial infarction. He also has chronic obstructive pulmonary disease.
Paano niya nakuha yung virus?
He doesn't have the virus. He is negative for nCoV. He has comorbidities. He was just classified as a patient under investigation because he had cough and he has that history of travel from Taiwan.
Okay, thank
Okay,
you.
next question, Ms. Aiko.
Sir, regarding naman po dun sa profile ng mga repatriates po natin who were brought to Bilingan and then the Bataan, kailan po sila nadala doon? And then as of now, yung pong isang na-rush po sa Bataan, is she still in the hospital po?
Yes, actually yung current na pinadala po doon sa kanila ngayon, who has experienced the anxiety-related symptoms, she's still there in Bilingad waiting for the coordination and transfer to our hospital in Bataan. Yung isa po, the other one, yung 26 years old na nag-exhibit ng fever and ear pain, was already sent back to the New Clark City quarantine facility because the patient is now afebrile. So lahat po nung mga dinadala natin sa referral hospital, once sila ay lumabas na negatibo, sila po ay binabalik na dun sa quarantine facility para matapos nila yung 14-day quarantine period.
Just to be clear po, but their symptoms are not related to coronavirus, ma'am, no? Basta makitaan ng symptoms, like for example, they get sick, they will be brought to hospital.
Of course, ma'am, we need to manage whatever symptoms they would be exhibiting para po sila ay masuportahan. Ngunit yung kanilang mga pinakita, katulad ng anxiety at katulad po ng ear pain, ay hindi naman po related sa nCoV.
Last two questions, Janelle and then Sir Rafi. And that's it. Thank you.
Curious lang po, the anxiety that the other patient developed, was it in any way related to being isolated or having come from China?
Sa ngayon, hindi natin masabi, ma'am, no? Kasi dadalhin nga namin po siya doon sa ating isang ospital kung saan may mga eksperto po kami, mga psychiatrists that could assess the patient. Pero ang ipinakita niya ho mga simptomas ay hindi siya nakakatulog at medyo balisa po siya. So, hindi ho natin masabi sa ngayon.
Thank you.
Sir Rafi.
Ma'am, with regard to the contact tracing, it seems na a little bit over a half pa lang po yung contact trace from all three cases. Can we know, because Yusek Domingo has already mentioned that the reason for the delay is because some of the passengers are inputting erroneous phone numbers and emails, but can the PNP really justify this as so? Because parang ang hirap naman pong magbigay ng erroneous numbers when that's the only way that airline companies can contact you.
That would be one of our issues currently. No? Pinag-usapan na rin po yan with the other agencies kung saan po tayo po ay nakakita, no, ng mga erroneous na mga detalye na ipinasok ng ating mga pasahero at hindi lang po yun, erroneous and incomplete actually. Kasi pag tinatawagan po namin, kulang pala ng isang numero yung binigay na number. Yung iba naman po, pag tinawagan, cannot be reached anymore. But we've already sat down with relevant agencies regarding this matter. Actually, we have sat down with the PNP, CIDG, and COMELEC so that we can have some resolution to this issue so that the next time around we will be able to prevent this kind of circumstances to happen.
But the IATF will complete the contact tracing no matter what?
We are still trying to complete the list so that we can trace everybody. And as I've said, that's why we have coordinated with COMELEC and PNP, CIDG on what would be the best thing to do for now, now that we have this incomplete list of data coming from our contacts.
Okay, thank you very much. So we'll be limiting questions because of the incoming meeting. For other details, you may refer to the lagging handa video. And on Monday, we'll be having a more comprehensive press briefing and updates. Thank you very much.
Get the para tayo. Taiwan? Coming from Taiwan? Okay, sige. Ang ating profile nung recently patient under investigation who died, it is a 71-year-old male. He is from La Union. His history of travel to Taiwan was from January 24 to January 31 of 2020. He was, his onset of cough apparently started last January 20. And he was admitted at JBL February, he was admitted in Lorma Medical Center in somewhere in La Union, where he on February 11 at 7 o'clock in the evening. And then on, yun po yung sinabi natin, he was given supportive measures, mga diagnostic procedures, and after a while, he succumbed to death. Because of ang final diagnosis nila was community-acquired pneumonia, and also he had acute myocardial infarction. He also had chronic obstructive pulmonary disease, and also they were considering thoracic aortic aneurysm. So this patient had comorbidities at the start, but the nCoV test was negative. Just to make it clear, it was negative. We do not have the specific time of death, but Meng will be giving you, we will be getting it from Region 1, because as of this time, we just got all the information because they were just processing the documents when we called. We will be discussing that this afternoon. Actually, that's why we are in a hurry, because we have an interagency task force meeting this afternoon, and we will be discussing all of these issues together with the other agencies. And as Meng have said, on Monday we will give a more comprehensive update to all of you.